Welcome to the certificate course on reproductive health education. In today's session, let us discuss on anatomy of male reproductive system. Male reproductive system. The structures of the male reproductive system include the testes, the epididymis, the penis, and the ducts and glands that produce and carry semen. Sperm exits the scrotum through the ductus deferens, which is bundled in the spermatic cord. The seminal vesicle and prostate gland add fluid to the sperm to create semen. The prostate normally doubles in size during puberty. At approximately age 25, it gradually begins to enlarge again. This enlargement does not usually cause problems. However, abnormal growth of the prostate or benign prostatic hyperplasia can cause constriction of the urethra as it passes through the middle of the prostate gland, leading to a number of lower urinary tract symptoms, such as a frequent and intense urge to urinate, a weak stream, and a sensation that the bladder has not emptied completely. By age 60, approximately 40% of men have some degree of benign prostatic hyperplasia. By age 80, the number of affected individuals has jumped to so many as 80%. Treatments for benign prostatic hyperplasia attempts to relieve the pressure on the urethra so that urine can flow more normally. Mild to moderate symptoms are treated with medication, whereas severe enlargement of the prostate is treated by surgery in which a portion of the prostate tissue is removed. Bulbourethral glands. The final addition to semen is made by two bulbourethral glands or corpus glands that release a thicky, salty fluid that lubricates the end of the urethra and the vagina and helps to clean urine residues from the penile urethra. The fluid from these accessory glands is released after the male becomes sexually aroused and shortly before the release of the semen. It is therefore sometimes called pre ejaculate. It is important to note that, in addition to the lubricating proteins, it is possible for bulbourethral fluid to pick up sperm already present in the urethra and therefore it may be able to cause pregnancy. The penis. The penis is the male organ of copulation, that is, sexual intercourse. It is placid for non sexual actions such as urination and turgid and rod like with sexual arousal. When erect, when erect, the stiffness of the organ allows it to penetrate into the vagina and deposit semen into the female reproductive tract. Let us see the cross section or cross sectional anatomy of the penis. Three columns of erectile tissue make up most of the volume of the penis. The shaft of the penis surrounds the urethra. The shaft is composed of three column like chambers of erectile tissue that span the length of the shaft. Each of the two larger lateral chambers is called a corpus cavernosum. Together, these make up the bulk of the penis. The corpus spongiosum, which can be felt as a raised ridge on the erect penis, is a smaller chamber that surrounds the spongy or penile urethra. The end of the penis, called the glans penis, has high concentration of nerve endings, resulting in every sensitive skin that influences the likelihood of ejaculation. The skin from the shaft extends down over the glans and forms a collar called prepuce or foreskin. The foreskin the foreskin also contains a dense concentration of nerve endings and both lubricate and protect the sensitive skin of the glans penis. A surgical procedure called circumcision, often performed for religious or social reasons, removes the prepuce typically within days of birth. Both sexual arousal and Both sexual arousal and REM sleep, during which dreaming occurs, can reduce an erection. Penile erections are the result of vasocongestion or engorgement of the tissues because of more arterial blood flowing into the penis than is living in the veins. During sexual arousal, nitric oxide is released from nerve endings near blood vessels within the corpora cavernosa and spongiosum. Release of nitric oxide activates a signaling pathway that results in relaxation of the smooth muscles that surrounds the penile arteries, causing them to dilate. This dilation increases the amount of blood that can enter the penis and induces the endothelial cells in the penile arterial walls to also secrete nitric oxide and perpetuate the vasodilation. The rapid increase in blood volume fills the erectile chambers, and the increased pressure of the filled chambers compresses the thin walled penile venules, preventing venous drainage of the penis. The result of this increased blood flow to the penis and reduced blood return from the penis is erection. Depending on the flaccid dimension of a penis, it can increase in size slightly or greatly during erection, with the average length of the erect penis measuring approximately 15 centimeter. Scrotum. The testes are located in a skin covered, highly pigmented muscular sac called the scrotum that extends from the body behind the penis. This location is important in sperm production, which occurs within the testes and proceeds more efficiently when the testes are kept 2 to 4 degrees Celsius below core body temperature. The dartos muscle makes up the subcutaneous muscle layer of the scrotum. It continues internally to make up the scrotal septum, wall that divides the scrotum into two compartments, each housing one each housing one testis. Descending from the internal oblique muscle of the abdominal wall are the two cremaster muscles which cover each testis like a muscular net. By contracting simultaneously, the dartos and cremaster muscles can elevate the testes in cold weather, moving the testes closer to the body and decreasing the surface area of the scrotum to retain heat. Alternatively, as the environmental temperature increases, the scrotum relaxes, moving the testis further from the body core and increasing scrotal surface area, which promotes heat loss. Externally, the scrotum has a raised medial thickening on the surface called the raphe. The scrotum and testes. This anterior view shows the structure of the scrotum and testes. The testes are the male gonads, that is, the male reproductive organs. They produce both sperm and androgens, such as testosterone, and are active throughout the reproductive lifespan of the male. Paired ovals, the testes are each approximately 4 to 5 cm in length and are housed within the scrotum. They are surrounded by two distinct layers of protective connective tissue. The outer tunica vaginalis is a serous membrane that has both a parietal and a thin visceral layer. Beneath the tunica vaginalis is the tunica albuginea, a tough, white, dense connective tissue layer covering the testis itself. Not only does the tunica albuginea covers the outside of the testes, it also invaginates to form septa that divides the testes into 300 to 400 structures called lobules. Within the lobules, sperm develops in structures called seminiferous tubules. During the seventh month of the developmental period of the male fetus, each testis moves through the abdominal musculature to descend into the scrotal cavity. This is called the descent of the testes. The sagittal view shows the seminiferous tubules, the site of sperm production. Form Formed sperm are transferred to the epididymis where they mature. They leave the epididymis during an ejaculation via the ductus deferens. The tightly coiled seminiferous tubules form the bulk of each testis. They are composed of developing sperm cells surrounding a lumen. The hollow center of the tubule, where formed sperms are released into the duct system of the testes. Specifically, from the lumens of the seminiferous tubules, sperms move into the straight tubules and form there into a fine meshwork of tubules called the rete testes. Sperm leave the rete testes and the testes itself through the 15 to 20 afferent ductlets that cross the tunica albuginea. With this, I conclude today's session. We'll meet in the next session. Thank you.